coughing? Do you have watery eyes? Does your nose itch? Do your eyes itch? Take a seat because you might be from the club. Welcome to my channel. My name is Charmelle Lima, and today I want to talk about allergies. So this is allergy season, which is usually in the spring, and sometimes it continues a little bit into the summer. But basically, it's due to the level of pollen in the atmosphere. I mean, in the air. So it's not the only allergy that happens. There are a lot of allergies. There's food allergy, like environmental stuff allergies, like people are allergic to pollen, which is normal, during this season. And some people are allergic to chocolate, some people are allergic to eggs, some people are allergic to like medicine. And well, what I want to talk about today is pollen allergies. Well, I'm currently having allergy symptoms right now because I am allergic to something, and it's not pollen. But because it's pollen season, then I wanted to talk about like the typical symptoms of allergies. So typical symptoms, you're gonna be coughing a little bit. It's usually, sometimes it's a dry cough, like and nothing comes up. But sometimes you might bring up some mucus, and the mucus might be anywhere from clear to brown. And that does not mean necessarily that you have an infection. Sometimes it's still the allergy itself that's causing you to cough that kind of mucus, because the mucus, your phlegm, the mucus that's normally in your throat and like your nose cavity is meant to trap anything foreign that is in the air and does not match with your homeostasis. So your mucus is gonna trap that, and whatever color it is, it's gonna be the color of whatever foreign was in your cavities, or your like whatever your mucus trapped. So it might be green, and it's not. Like, I was at the doctor's office, and he told me that green mucus does not mean infection, bacterial infection necessarily. So that was really cool for him to tell me that. So that's plus one that I know. I can add that to my knowledge now, so I'm gonna share with you guys. I was allergic to pollen, and those symptoms are itchy throat. Sometimes you might have a sore, like really sore throat, or it might be itchy. Your throat might be itchy, or you might be coughing a little bit. You might be coughing dry cough, or like productive mucousy cough, whatever color it is. You might have a fever, but it's not typical. It's not very like it's not very usual to have a fever when you have allergies. Okay, and you like watery eyes is one of the symptoms, and itchy eyes, and also runny nose and itchy nose. It's just like you can't. It's just like you feel like the nose is always congested. It's because of all the things that are in the environment. Your mucus you're producing more mucus to be able to trap whatever is like coming into your nose. So you might feel your nose is stuffy all the time because the mucus you're producing more mucus than normal, just to be able to trap all of the foreign like pollen or whatever you're allergic to. Then that's why. And also you might also, because if you cough a lot, you might have also like chest pain, but it's not related to. But make sure it's not related to your heart. If it's like internal, you can feel it when it's internal, like all the way in, and you can tell when it's from like the coughing. Usually when it's from the coughing, it's like more in the middle here, and you just feel like when you cough, and it's when you cough that it hurts. But if you have chest pain or arm pain, or like back pain around like the little right here, like around the heart, whether it's from the front or the back, or it's your arm, your left arm or your right arm, sometimes go to a doctor and get checked, because that is not normal for just allergies. So the typical symptoms of allergy are those: the itch. Okay, let's start with the eyes. Watery eyes. Sometimes you might feel like you might have like pain in your eyes. Your eyes might be red sometimes. Nose, itchy nose, sometimes pain because you've been sneezing and like blowing your nose so much. Red nose because you've been sneezing and blowing your nose all often. You might feel like nose congestion. You might feel congested in your nose because so much mucus is building up there. Mouth. So let's talk about the throat actually. So pain. Usually the pain doesn't last that long, and if it lasts that long, then that means you should probably get checked for strep. But usually, if the symptoms have been going on for like a week, like 4 days, then like for the first couple days you have a sore throat, and then afterwards it's gonna be itchy or just like it's gonna feel like weird, and people usually call it post nasal drip because the mucus is going like in the back of your throat so much, it's like running so much there that you feel like a little bit irritated there, and it's not very comfortable. You just feel like something is there. It's not painful. It's not like it's a little bit of pressure, but it's not painful, and it's very difficult for patients usually to explain it, but we call it post-nasal drip. If you feel like mucus is like draining down the back of your throat and it just feels weird, or you feel pressure there, then that's probably post-nasal drip. And so throat and chest, you might have chest pain, but remember, it has to be, you have to feel that. I mean, it usually you feel that it's from the coughing that you have the chest pain, like usually in the middle right here. Some people have it elsewhere in the back and stuff, but make sure if you have palpitation, like you hear your heart beat like very fast, and you have arm pain or pain like that, or if you have difficulty speaking and stuff like that, then go and get checked. If you're aware of what is going on, then either call the ambulance or have somebody drive you to the hospital, because that might be a heart attack or a stroke. But I'm not a doctor, so whatever, if something like that happens to you, then make sure you get checked, okay? And also, sometimes people have body aches, like very strong body aches, and sometimes they have a fever, but that fever is usually for like a cold, or if you have the flu, or sometimes if you have strep. But for just allergies, it's not usual to have a fever. You definitely need to get checked, because fever is not good. It's like fever can make you dehydrated like that, and like dehydration is a leading cause of death in some countries. So yeah, you need to make sure you get that checked. And what are the remedies if you have allergies? Sometimes it might be the pollen, sometimes it's dry air, just dry air, or like stuff like that. So what my allergy was at one point, like, it was about a month ago. I still have allergies, but that has to be something else. So when I was out, I had an allergy a month ago, and I went to the doctor, and I was actually allergic to dry air. So what we don't realize sometimes is that you have to remember, you have to think about when exactly the symptoms are the strongest. Me, it was early in the morning and late at night when I'm about to go to bed. So what does that mean? Where am I when early in the morning when I wake up, and late at night when I'm going to sleep? I'm in my room. Duh, I did not even think about that at first. But then afterwards, I was thinking about it, and as the doctor was speaking to me, I realized it myself, and I told the doctor, oh, it might be my room. Yeah, so that's what doctors like to ask you questions like that often. So what my allergy was, it was dry air in my room. So what the doctor recommended is an antihistamine medication, basically to decrease the symptoms, like the itchy and like runny nose and like watery eyes and painful eyes and itchy eyes and the coughing and stuff. Yeah, I'm not gonna tell you exactly the medication I got, because I don't want you to get that medication if it's not sure that you have the same thing as me, you have just an allergy. So I would still recommend to get a doctor check you first before you get any medication. yeah, so yeah, basically he gave me an antihistamine, and that helped with the symptoms. And also my doctor recommended me to get a vaporizer. This is a vaporizer right here. It's from Vicks, and I use it at night. It's in my bed. It's on my bed. I and basically it humidifies. Wait, did I say vaporizer? Yeah, it's a vaporizer. So it humidifies the air because it's dry air in my room. So it humidifies the air, and let me tell you, I was sleeping like a baby the night that I put it in my room. Because, you know, like, I was able to breathe better, and I wasn't sneezing at night. I was like, I've spent like a nice night, and thanks to that vaporizer. So if you do get a vaporizer and you leave it on your bed, it's best to like put it somewhere in your room, not very like somewhere in your room close to your bed. But I put it in my bed because, you know, I like to feel the warm air and, you know, the air coming out of it. But be careful, if you put it in your bed, make sure it's very far from you, because it is hot, because you plug it in the outlet. Oh my god, my throat is itchy. Anyways, so yeah, so make sure you put it away from you. Make sure it's far away from you enough to not like touch you, because it is really hot. And if it touches your skin and you're sleeping, you don't know what's going on, so you might wake up with a burn, and you are just trying to get nice air to come into your lungs. No, that's not good. So make sure it's far from you. And also, because not just directly touch you, but also the water that's in it can just jump out and like touch your skin, and it's really hot water, so it might leave you a burn there. So you want to be careful for that. I made sure I put my fan on all night so that like whatever dry air can go out of the room. During the day, I left my door open and I put the fan on so the dry air can go out of the room. So let the air out, and, you know, maybe dust your room, dust around your room, and like clean your wash your sheets. I'm used to wash my sheets every week. My sheets and my pillows, my pillowcases, even my my teddy bears. Even my teddy bears, all of them here. Yeah, I wash them every week also. So I am not like a dirty person, but I still got the allergy symptoms. So it might not be because you're like quote unquote a dirty person or like not very clean person, but you know, if you have those symptoms, I mean, obviously you have something going on. So go and check your doctor. You might have all the symptoms I talked about, and you still don't have just an allergy. You might have something that's more than that, or, you know, I don't know. So make sure you go in and get a child and have a doctor check you and tell you exactly what's going on with you. And make sure you tell them all the symptoms, answer their questions, because they're trying to help you and stuff. And this is where I'm gonna end the video. So remember, I'm not a doctor. I work as a medical assistant, and I have an associate degree in biology. So I kind of know what I'm talking about. I do know what I'm talking about, and I made my research. And from my experience at working as a medical assistant and talking to doctors around me, which I work with, then I have the experience to be talking about this. And it did happen to me also. I still have the symptoms. My throat is itchy, my nose is running, my nose is stuffy, and I have headaches also. But yeah, that could be a sign of allergy also. I forgot to mention that earlier. So yeah, add that to the list. And yeah, so I'm not a doctor, so what I'm saying right now is purely from experience, personal experience, medical assistant, working as a medical assistant experience, and also having a biology degree. We talked a lot about like symptoms and stuff like that in class when I was in. Well, I'm about to start school again, but when I was doing like that program for my associate degree in biology, we learned that in class also. So I believe I have enough experience to talk about this, okay? So until next time I post a video, stay tuned. Like, make sure you subscribe, click the thumbs up to like this video, and comment your thoughts below. Comment anything that you want to tell me, anything I should talk about in my next video, or anything, your thoughts about this video. If you want to add anything to what I said, if I forgot to mention something or anything, let me know in the comments, and share this video if you want. Somebody might want to listen to this. And yeah, so next time I'll see you guys, and make sure you stay hydrated. That's one thing. I don't have my water bottle today, but stay hydrated, live happily and beautifully.